Greetings once again. It's our pleasure to be back and it's a pleasure to share with you in this particular episode. And for me today, I'm going to talk about reimagining education with a focus on translation of knowledge into skill sets. We all understand and have to embrace this fact and reality of life in the sense that education is supposed to be a transformative experience. Education is about you acquiring knowledge, contextualizing it and understanding the environment within which you're operating, and at the same time making use of that information to offer a solution, to address a problem, and also to live a better life and to be in harmony with the ecosystem by the virtue that you're able to respond to it the way it's required of you because you have preferential knowledge and differential capabilities based on your training and education. And the education is not only within the education system in the sense that you are trained to learn a particular subject and all that, but also the relationship that you make with people, the mentorship experiences, the coaching experience that you go through as part of your education. So the core of it is education is a transformative experience, and that is critical for us to understand. So then when we move from that point to go to the aspect of pharmaceutical education in the pharmaceutical education, that is, so when we talk about pharmaceutical education, is about training a professional or training a learner in a university setup or an academic institution of higher learning, whether diploma level, degree level, masters, or even PhD level. This is around training somebody to be a subject matter expert within the pharmaceutical systems and pharmaceutical science domain. So there's a scientific principle to it, there's a clinical perspective to it, and there's a business acumen and leadership capabilities that are built into you as a pharmaceutical specialist or subject matter expert after your training. And therefore, the key commitment and component of pharmaceutical education is to be able to transform you from a novice enthusiast and novice learner, in the sense that you don't have much of the knowledge, but you're willing to move from that point where you have limited knowledge to be the expert in that area, and ultimately to be able to apply your knowledge, preferential knowledge and capabilities in transforming care delivery when you're working in the clinical service setting as a clinical pharmacist or clinical pharmaceutical technologist, whichever way that you're offering clinical services. If you're going into the industrial space, we're expecting you to be able to use your technical knowledge and training from the industry, from your schooling education, to be able to deliver in industrial pharmacy practices, whether in your production, quality control, quality assurance, regulatory affairs, pharmacovigilance, whichever way it is, you are able to translate that knowledge to make a difference. That is critical. If you're looking at it from the entrepreneur or the business perspective, are you able to envision, to design a business model based on your knowledge? Are you going to offer the knowledge? Are you going to offer a service or a product in the clinical, your business model and your entrepreneurial journey? And in so doing, you're applying the technical knowledge that you've gained as a student. So that translation of knowledge is important. So that is the first thing that we have to understand. The education is to be able to transform you from somebody with limited knowledge and limited capabilities to deliver on a particular solution to somebody who has mastery and has gained the knowledge. And beyond just having the subject matter technical knowledge, is being able to use that knowledge to deliver a solution, to address a problem, and to serve in that particular capacity as an expert. Very important to acknowledge that. So why are we talking about it in terms of translation of knowledge into practical skills? Over time, we all acknowledge that one of the key challenges that we're dealing with is unemployment. And this unemployment is not only to the pharmacists, it's across board, across cadres, and cross professions all over the world. And as much as unemployment is a problem that we're all contending with, we have to ask ourselves, what is it that is an impediment in terms of getting employment? The one thing, and I've done a couple of videos around such kind of things where I've been talking about other areas that we can venture in, for example, global health pharmacy, pharmacovigilance space, regulatory affairs. I've talked about business development as a subject matter, as a skill that pharmacists can offer. And all these are possibilities. But the question is, when you talk to young professionals, and these are conversations that I had even the previous week, I was talking to some of my colleagues, and the question is, most hospitals are not hiring. I'm not supporting hospitals not employing and calling for the right people to be employed to offer the services. Because at the end of the day, my mission is to ensure that if somebody goes to a hospital, they're able to get the right qualified professional. The pharmacist, the nurse, the medical doctor, the physician, the clinician, the nutritionist, who is going to be able to offer the medical services that they need. Because at the end of the day, I expect that if I am unwell as David, I'm able to go to a hospital and get the right quality of services as well. So how does that happen? when the hospitals are employing the right people. Unfortunately, when you look at the dynamics as they are, however much, even all if all of them employed, there will still be some people who will need more employment opportunities, probably outside the conventional, and there are also some people who are not configured to practice in that clinical setting and are exploring alternative pathways. And the only way they are able to explore these alternative pathways and alternative career opportunities is by one being able to acknowledge these career opportunities exist. And that is why I've been doing a couple of these videos around these particular career opportunities that are available for pharmacists and for generally young professionals in the healthcare space. And I believe that would be a good starting point. But after knowing these skills, so these opportunities are there, these career pathways are available, the next question you need to ask yourself is, how do you get into them? And that is the reason as to why I'm going to it in terms of education. In the last couple of months and last couple of weeks as well, I've had this workshop where I've participated with colleagues and with peers in the industry. And some of the conversation that have been happening is education, capacity building for young professionals and all that. I acknowledge capacity building needs to be there. But the question is that training able to give me a skill or the knowledge that I'm able to apply in another line? The translation of that knowledge into practical skills. And if you're talking about translation of knowledge into practical skills, if I'm trained on industrial pharmaceutical practices, then I should be able to actually comprehend and see if I've learned good manufacturing practices and good distribution practices, how do I put it into context? Then you need to bring it to the sense that after learning how to work around GDP, GMP requirements and all that, then your role as a technical expert who understand the principles behind it, how would you support? What skills, what services does an industry need from a pharmacist working in the quality assurance? You will be responsible in development of standard operating procedures, working instructions, global operating procedures, and also performing audits and quality inspections to ensure that everything is done accordingly. 2, you'll be responsible for documenting industrial processes and related. So then it means if I'm trained on GMP, GDP, GXP and all those kind of good practices within the pharmaceutical setting, I'm already seeing where I can apply them. I can set up structures on SOPs and working instructions, what need to be done, when, where, how, by who, so that is clear for me. That is the translational aspect of it. Unfortunately, most of our training is not looking at that, and that is why I believe we need to reimagine that by looking at what are the possibilities in terms of career opportunities. And once we've understood what are the opportunities in terms of careers, in terms of the needs in the market, then we're able to see the training in terms of the technical know-how is robust and effective enough. But then we need to look at how do we translate these technical training and technical skills that we are equipping our young pharmacy students and graduates with as they transition from school, and actually encompass it in the sense that we are packaging it with additional translational or transferable skills that they are able to apply in the market. When they go to the market, they are not green on what needs to be done, but rather they know what kind of tasks they would be assigned in those particular spaces of work. And that is one key limiting bit in the sense that most people would go into the clinical because it's conventional. We already know I'm going to do clerking with the patients, I'm going to dispense medication, I'm going to do counseling services and all that. But then it's not that all the aspects of clinical pharmacy are already encompassed and covered for. When you talk about medication therapy monitoring, what are the other skills that are there? Those are things that we need to look at in the sense that we've trained you as a pharmacist, you have the technical know-how, you need the additional professional competencies and the translation of those skills, that knowledge into skills. And the skills will be in terms of the activities that you're performing in your place of employment, in your place of professional engagement or vocation as it is. And that is important. And then the question that we need to ask ourselves is, if we are imagining education and we are ensuring that we are fostering the translation of knowledge into practical skills, how does it happen? This is how it would happen. 1, there are professionals who are working in all these domains, either by serendipity or some of them were intentional and pursued these other career lines, which would be good for them. But now, because they are at an advanced space, where already in that space they're practicing, they're gaining the knowledge, and they're able to know what are the nitty-gritties, the intricacies of that particular domain, they have a responsibility to bring it back. And that is one of the key things that we are trying to do within the videos that I normally record as well, the interviews that I'm doing under the Footprints project. Can we document the stories of experts in these particular lines who can share with us those experiences, those insights, and those nitty-gritties that would empower us to be able to know what more we can do? So those people have a role to shape these conversations. And how would they come in? We have professional associations which have a role in terms of professional education, because the professionals they represent have to be trained and educated. And the only way they would be trained and educated to be the right professionals in their line of work is by ensuring the training is robust enough. So professionals who are in market through the professional associations can contribute to capacity building and training, either by collaborating with universities or either by offering these experiential learning opportunities, and not only experiential but guest lecture opportunities for people to know more about what needs to be happening. But it doesn't have to be in ad hoc capabilities. It needs to be structured into the curriculum, where that means the curriculum reviews have to be responsive to the market needs. So those are some of the things that needs to be done, and that are going to move us a step forward. So the professionals having to transfuse their knowledge into this. The other thing is universities and institutions of higher learning have to embrace the industry. You have to embrace the clinical practitioners, the industrial space, the entrepreneurs in the healthcare space, so that they're able to have a blending network where that integration, that nexus is there. The academia and the industry knows that they have a role, because the industry will depend on the graduates to be plugging into ensuring that they have the labor that they need in terms of the market. But at the same time, they don't want to get somebody who is totally green, who doesn't understand what are the intricacies and the nitty-gritties of that work. And that is kind of a transition that we're looking at. So how do we make these things move forward? How do we ensure that we transform this wheel? The industry and the university have to collaborate. And some of the collaboration mechanism, and these are conversations that I've had with some of our administrators in the respective schools of pharmacies, not yet taking off, but we're hopeful that at one point they will take off. I am a proponent of education, and I do a lot of learning and reading about other universities. Stanford University, as one of the premier universities across the world, has been doing a couple of guest lectures. And if you look at them, you find the industry is sharing perspective and collaborating with people. And this is one of the conversations that we started, and I'm glad that some of the university students have adopted this. For example, University of Nairobi Pharmacy Students Association, they have these mentorship talks where people share with them. We started one in JQuat a while back, the JEPSA alumni chat, where the alumni could share perspectives. And if we have these kind of guest lectures, university students are getting exposed to what possibilities are out there, and the faculties are also knowing what are the emerging trends. Because if you're not based on the emerging trends, you'll train somebody for 10 years back, and in you training them for 10 years back, they're not able to plug into the market that they're going into in the immediate moment, which would be a lost opportunity. And that is a critical thing that we need to look at. Ultimately, the other thing that we're currently working on, and this is something that I would urge you more to look into and see how you could engage. As African Pharmaceutical Network, we established a platform where we're able to collaborate with professionals, we're able to collaborate with industry, and we're able to collaborate with individuals from student level to the senior most experts. Being to the platform where we build capability, we have the Pharmacy Academy. We've already rolled out regulatory affairs training program that is ongoing, a professional development course, taking 10 weeks, 3 months, that is averagely with guest lectures, where you get to learn about the intricacies of this practice. And the more of the courses are being developed with industry and by industry's experts who are willing to build the next generation of industry pharmaceutical experts and industry leaders who are going to transform our sector. That is critical. We need to have such kind of interventions. And I would urge you, please plug in, see how you can engage. How do you begin to apply your skills? Where are you applying that skill? What can you do within those networks? And it's important. And the other thing, once you've been trained and once you get the capability to do that, the next bit is how do you gain the experiential learning and actually put your skills into use? That is where we are looking at partnering with as many organizations as possible who can give these experiential learning opportunities. But at the same time, we urge you as an individual, seek out opportunities. You cannot sit back and wait for an advertisement to come. That used to be the case, but if you're going to keep waiting for the advertisements for internship attachment or anything or job employment opportunities to come up, they might not come up because they're already limited, and we acknowledge that. So how are you making the step to present yourself in the case where if somebody is seeking to employ, you'd come top of the mind because you've always been engaging and you're already in the space where they know you need these opportunities? Because if you sit back, as I see most of us are sitting back and waiting for the advertisements, they might never come to us. And if they don't come, we will regret that missed opportunities because we have the capabilities, we have the know-how, but we are not in the right places. Every organization does marketing. Why do they market? If only they knew that everybody needs their product and that is why they developed them. Why do they market? Because you need to bring your product to the people who need it. You see yourself as a business. Your goods and services are the technical capabilities that you have. Go to the market the solution that you can provide for them, let them be interested, and then make a sale by taking the opportunity and delivering the service. Sitting back doesn't help you, and you need to see, how do I translate that knowledge? And that is a challenge that I'm giving you as young professionals and even senior professionals who might find value in these. Go out there and market your skills. Once you market your skills, you know what capabilities you have, you're able to transform the organization. Then once you sell it, you're going to get the opportunity, deliver exemplarily well, in the sense that you've marketed. The sales and marketing component is key because you've already positioned yourself where you need to get the value. Two, when you got the job, you delivered exceptionally well. That is where the product-led business growth that you're delivering, more people will look for you because you have the capability to deliver on the solution. The company will appreciate you more and probably give you promotion opportunity because they will not want to lose you, because you're building yourself and delivering value in that space. If you don't see yourself as a business, I'm really, really sorry about this, because at the end of the day, we will keep complaining, we'll keep pointing out the challenges that are in the ecosystem. But as much as we complain, complaining doesn't solve our problems. We need to get into the ring, do our fair share of the work, and get things moving, because I believe that is what will make a difference in our ecosystem. I urge you to join us on Africa Pharmaceutical Network and even the Reculture Youth Voices Network, where we do mentorship program with young people. Come be part of such networks, learn from others, see how we can change our education system, how we can position ourselves as experts, and how we can grow in our journeys as professionals. And I would urge you to do more, do better, and get moving. Collaboration is the key, but we can't collaborate when we're coming together. The education institutions, reach out to us. Let's partner. Let's make a difference. Let's empower the young generation, because unless we empower them, then the future of our industry is at risk. And the only way it can stop being at risk is we invest in them, we build capability, envisioning a future that we desire. And that future that we desire will be the change that our young people need. And I'm hoping we're able to work on it together. Thank you so much for listening to me through this end. If you enjoy the discussion, you enjoy the insight that I'm sharing, subscribe to the channel, share with your colleagues, and keep engaging so that we get better as we move along. Thank you and have a good one.